My name is Dr. Ajul Shah. I'm a board-certified plastic surgeon with a subspecialty board certification in hand and upper extremity surgery. I'm the chief and medical director of the Center for Hand and Upper Extremity Surgery. A hand fracture is basically a broken bone in the hand. The hand is comprised of a significant number of bones, and they can be injured in a variety of different ways. Most common hand fractures that we treat at the Center for Hand and Upper Extremity Surgery would be metacarpal fractures and phalanx fractures. Metacarpal fractures are basically broken bones here of the long bones that are within the hand. You have 4 here corresponding to the 4 fingers, as well as a thumb metacarpal. Phalanx fractures are actually located within the fingers themselves, so there's 3 different phalanxes that can be broken: proximal, middle, and distal phalanx. If you suffered an injury and you think that you might have a hand fracture, generally you'll see a significant amount of swelling in the hand, a significant amount of bruising, perhaps a lot of pain, and even in severe cases, your fingers or your hand may be twisted in a way that doesn't seem right. If you think that you have a hand fracture or a significant injury to the hand, the first step is to come in and see one of the surgeons at the Center for Hand and Upper Extremity Surgery. The first thing that the surgeon will do is evaluate your hand specifically to see where the injury may be. The first step after that is usually to obtain x-rays. The surgeons at the center will actually do your x-rays in the office, so you don't have to go to another location, and you can get some real-time feedback on whether or not you have a fracture. In scenarios where the x-rays are not completely obvious as to whether or not there is a fracture, you may end up getting a CT scan or an MRI. Treatment options for hand fractures are really dictated by what the fracture is, what the position is, and how bad it is. In simple fractures, there are times where we can treat you with a cast or even give you functional braces, where we set you up with a hand therapist and they can actually put you into a brace to protect the fracture while also allowing you to move your fingers so that you don't get stiff. It's a nice treatment option. In scenarios where it's more significant, you may need surgery to reset the bone and hold the bone together. At the Center for Hand and Upper Extremity Surgery, we specialize in specific techniques in which we can fix the bone break in a way that doesn't require you to be immobilized for a long period of time, as well as lose a lot of function due to stiffness and problems with range of motion in the future. We use what's called rigid fixation techniques, where we try to fix the bone in a way that allows you to move it very early under the guidance of a hand therapist, so you can get back to your life, your activities, your sports, your work as quickly as possible.